Hello and welcome to another video on ECG. Before we start, I would suggest to pause your video and have a look at the ECG of this young patient with the history of intermittent recurrent palpitations. Alright, I'm sure that most of you with some basic knowledge of ECG might have found the correct diagnosis based upon this ECG. But in this video, I would not only describe the ECG findings and diagnosis, but I would go one step further to explain the underlying mechanism of these ECG changes, as well as there is some more information which we can get from this 12-lead ECG. So if you have a closer look at lead 1, lead AVL, and in the later leads as well as lead V1, you can see the classical triad of WPW syndrome. That is, you can see a very short PR interval. It is less than 120 millisecond. Similarly, the QRS complexes, they appear broad and are approaching around 110 millisecond. And the initial portion of these QRS complexes, it appears slurred. And this is very typical of WPW syndrome. Now, the reason for all of these changes is due to presence of accessory conduction pathway between atria and ventricle. This accessory pathway carries the impulse originating in SA node through the atria into the ventricle, bypassing the normal AV node. As you know that normally there is a delay in AV node of around 120 milliseconds. So this impulse, which is carried from atria into ventricle by the accessory pathway, it starts depolarizing the ventricle myocardial cells even before the normal impulse through AV node has transmitted. This results in a short PR interval, as well as the initial depolarization of ventricle results in a widened QRS complex. But as soon as the impulse traveling through the AV node, it reaches the His-Purkinje system, which is a very fast conduction system. It transmits the pulse all across the ventricles, and it minimizes the effect of initial pulse transmitted to the accessory pathway. And as a result, the terminal part of QRS complex, it appears normal. Furthermore, based upon the direction of this upward slurring, also known as delta wave, you can explain the exact location of this accessory pathway as well. You can see that the delta wave in lead 1 is directed upward, while it is negative in V1. Which means that the initial current which transmits through accessory pathway, it flows towards the lead 1 and away from V1. And in this case, the accessory pathway is located on the RV free wall, resulting in transmission of current towards lead 1 and away from V1. Had it been the other case, in which accessory pathway is located in the left ventricle, you would find a positive delta wave in V1 and negative delta wave in lead 1. The significance of this accessory pathway in WPW syndrome is that it can result in AVRT kind of tachycardia, and in case of accompanied atrial fibrillation, it can be a very fatal condition. The treatment of this condition is through ablation of accessory pathway. So this is all for today. Hopefully you like the video. For more videos, kindly like and subscribe this channel. And if you have any comments, you can ask. If you have any questions, you can ask in the comment section. Thank you.